All right. Hello, everybody. So tonight, I don't really want to continue the trend that we seem to be painting this kind of dire picture for America. We talked about the poverty problem, the retirement problem, and it all seems to stem from the same sort of pattern. Now, Americans, we love to say, how good we are in business, in sports, but we're different than everybody else, and it's not for a good reason. Those of us here that have health insurance, is it provided by your employer?
Yes.
Now, imagine if we weren't so lucky to be in a position that, be gainfully employed, and if you weren't employed, do you have family to fall back on? Is there government programs that you would be qualified for? Now, if you weren't in any of these demographics, wouldn't the prospect of paying for healthcare scare you? Now, let's see. Bloomberg ranked the USA 46 out of 48 when they studied the efficiencies in the U.S. healthcare. Another organization, Commonwealth Fund, considers us the last in the quality for how much we pay. Now, we're spending $17.9 trillion a year on healthcare, and we're getting very little for our return. So, let's take a look at this. As it stands right now, 50 million Americans are uninsured. And, excuse me. Okay. So now, even with those of us that are insured, this 50 million don't even have access to that lackluster quality. They're without, and even if they did have it, it's not providing good return on investment. So, like we previously said, how we do have insurance through our employers, and there's a large amount of us who don't have any insurance. How does that affect us? In 2007, 2/3 of all bankruptcies in America were caused by medical illness. Now, if you're uninsured, it seems like a very easy thing to slip into. You get into a car accident, how do you pay for all this? But when they did this study, the Health Pack, which is another research organization, when they looked into this, almost every one of these bankruptcies were well-educated, they were high-income earners, and they had insurance to begin with. So this many people were being pushed into bankruptcy, even though they had health insurance, in a nation that touts itself as one of the best in the world. Now, I'm not trying to be a fear-monger by saying this could happen to you, but we need a solution. The system is struggling. So we can look into our global neighbors, our allies, and get some examples. It's not less than us from looking outside the box. Now, Walter, I was actually glad you showed up. I had France up there as a last-minute addition. France is actually considered one of the better providers of what's called socialized medicine. It's publicly managed insurance funds, and I believe the point was 70% of routine practices were completely reimbursed on the patient, and if it was a recurring ailment or disease, 100% of that is returned. And that's unheard of in the U.S. Now, obviously, it tends to be more from the conservative side that argues against socialized medicine and universal health care, whether it's single payer or not. The German model is actually, it seems like it'd be relatively easy to adapt in the U.S. because they have both public and private combinations of insurance providers. And if you think about it, I work in a hospital. Most of the patients I see are seniors, and they have some sort of public insurance such as Medicare, and their private companies as well. So people want to argue, to the truth about this, but it's almost what we have already. It just would iron out some more costs. Now, Singapore has an interesting model, which I also believe in. Every month, like a tax based on income, based on how much you make, it's taken and put into an individual account. Now, if any health costs arise in your personal life, it comes right from there, and then anything beyond that is supplemented by the government. It has that individual contribution, but your government's still looking out for you. Hong Kong, this really stuck out to me because it's known as an international hub for business. It's considered one of the freest economies in that regard. But over 90% of its public spending goes to its healthcare spending is from the government. And that's only 3.8% of their GDP, not some extreme that we're dealing with. So now, let's look into the future by looking at how much it grew in the last 10 years. 13, 18% of our, I need to amend a statement I said before. It wasn't $17, it was 17.8%. That was an absurd number for me. But so obviously healthcare costs are still rising. But with the recent implementation of the Affordable Care Act, they have started slow, but it's still going to keep growing. Now, this with some sort of universal healthcare install, it's going to start tackling this unlimited growth, because this is also starting to affect individuals and the labor force particularly. How often do you hear that more part-time workers are being added or hours are being cut so benefits aren't required? That's hurting the economy from every aspect, from the business, the employers, and the employees. More importantly, their personal lives and when it comes to receiving health care. Now, in the last 5 years alone, 10 major New Jersey hospitals have gone bankrupt. And those that still exist, over half of them have cut jobs and frozen wages. This isn't the sign of some corporate financial failure. This is indicative of a greater problem we have here in terms of reining in healthcare costs and installing some sort of form of universal healthcare. Now, let's see, looking forward, by 2030, enrolled patients in Medicare will double to 80 million. As of 2011, that was already our highest point. Obviously, the population is going to be living longer and needing more help. Now, we can keep pushing off this burden of how are we going to pay for this, how are we paying for it now, and how is this growth continuing. But if you look at this stat right here from the NASI, 75% of the most expensive procedures and ailments that were being taken care of right now could have been prevented. Now, obviously, Medicare is a very important program, but why not implement something like this from birth? Why not allow everyone to have that access to healthcare from the beginning? And maybe these prices wouldn't be so bizarre and astronomical. That's the end of my slides. Now, how can we, as citizens and patients, be informed on this matter? Well, there's obviously plenty of research already out there. There were a countless amount of government research, public advocacy groups, some of which I mentioned in my presentation. We have to take it as a citizen to be a well-educated citizen, and beyond that, a well-educated patient. Because there are programs that we can utilize now, and there will be further programs implemented because of the Affordable Care Act that we should utilize until better systems are in place. Now, even if you are insured, you're suffering with the rest of us who are uninsured, because even if people like to say, I don't want to have to pay for someone else's medicine. People like to say, it's going to be a drain on the system. But those of us without insurance, when they suffer, you're paying for that anyway. Whether it's in terms of them using local emergency facilities, that's going to have to come out of someone's pocket. And that's what I said with how many New Jersey hospitals have been closing. We can argue politics day in and day out, but there is a problem that requires pragmatic approach to it. Now, if you look past this issue, no matter what side of this, you have to look for the politicians and candidates that are going to be looking past this issue and not just simply trying to appeal Obamacare. That's fine if you don't like the policy, but you have to look for a solution. You have to have someone who offers a solution, not just bickering about the problem. Thank you.